I'm here today at State of the Heart Cardiology with Dr. John Osborne, and we're going to now see what literally it looks like when you take a person's heart, bring that out, and look at it in three-dimensional forms and see what's going on in the heart. Dr. Osborne's also going to share with us the other things that he can see on these very special images that's called a CTA, or a CT angiogram. Dr. Osborne, thank you.
Let me take you through this, Scott. When we take these images, we take about 3,000 slices in about 10 seconds. So it's a very rapid fire, high speed CAT scanner. And with this, it then allows us to take this data and, as I tell my patients, it's kind of a virtual autopsy. So let me take you through that right now.
You know, before we jump into that, perhaps it'd be good to talk about the process of getting the test for one moment. I've had 2 of them, so I've got a little experience. And for what you're about to show us, it really isn't uncomfortable at all to get this information.
It's done with a very fancy, sophisticated kind of CAT scanner. It's just a big donut. It's not like an MRI where you're going in a big dark tube. Takes about 10 minutes on the table generally, and to actually take the pictures is about 10 seconds.
That's amazing. So,
and that's it.
My experience with it was I came in, they put a little IV in, they put some leads on my heart, I laid down, I had my hands above my head. They said, take a deep breath, let it out, take a deep breath, let it out, take a deep breath, let it out. You can now get up and go.
That was it.
Amazing.
That's
so
it.
This is what we're going to see from that.
So as we take all those slices, we can then reconstruct this data. This is the raw data we look at first. Let me just orient you to what is on these pictures. This image here is the same data set, but now arrayed slightly differently. This is your heart in the middle. I call this the chest x-ray view. The heart in the middle. This is right lung. This is left lung. Down here would be your stomach, and there's your liver. The red bar shown here is actually that individual slice taken at that level. So I can go to the top of that slice here, or I can go to the bottom.
Okay, so this is looking at me from, like you're standing in front of, like we're standing in front of the person and looking toward him that way. This is like we're down at their feet,
right,
and you're taking a credit card level slice of them,
right,
and we're looking at them going up and down
slice
toward
like
their
this.
head.
That's
so
correct.
This is their neck,
right,
this is their feet.
You got it.
And this is what we're looking at from the side,
exactly,
or from the bottom. Sorry.
Exactly.
Yeah.
And so what we're seeing here, breastbone here, spine, right lung, left lung, heart is in the middle. First of all, we're going to look at the lungs. We do this because we find on average about one person, as we're scanning the heart to get information about atherosclerosis or plaque, about one person per month will happen to find an incidentally found, small, early, curable lung cancer.
Wow. Because
because you get all this additional
dogma,
data.
yeah, the dogma
right.
on lung cancers, we never catch it early enough. Right. So this is actually going to catch it early enough, possibly.
I just got a call yesterday. We had a fellow who, we did his heart. He was having chest pain. His heart was perfectly normal. But he had been a smoker, and he had a lung cancer. We diagnosed. Good news is I got a call from his doctor yesterday, and I mean, this is tragic. I mean, I was really worried about the guy. Get the call yesterday from his doctor. It was an early stage 1A lung cancer. They took it out. He doesn't need chemotherapy. He doesn't need radiation. Complete cure. He's done. And had it not been for the scan, not only did we find that his heart was fine, but we also found this lung cancer that would have only shown up several years down the road when it's incurable and would have died from it.
Wow, what a deal.
So let's look at the lungs here. So we're looking at the lungs. Right lung here, left lung here. Now this isn't, this is a different person. This is not you. But here we can see there's some scarring down here of the lung. Not unusual or atypical.
So the scarring appears as white. If the lung is usually black,
right,
and if you get this scarring right in here, you're looking at the white, and that tells you that it's thicker tissue.
Right.
Okay.
Not terribly unusual. No cancers, tumors, masses. We can detect emphysema here, even the earliest amounts of emphysema, pneumonias, fluid on the lungs. So we're looking for all that in the lung windows, as we call it.
And you didn't talk about this box right here, but I'm actually seeing, as you're doing here, this is looking at the person from the side.
We're slicing you right down the middle.
Middle. Okay. So as and this what we're seeing here is what we're seeing here.
Absolutely.
And what we're seeing here. This is the same right there.
All the same data set.
Got it.
Okay. Because when you do the scan, we actually get volumetric three-dimensional data,
so,
and I'll show you what it looks like
You've used the term virtual autopsy. That's
what you mean. This is the virtual autopsy.
It's like they're seeing inside of you without you
I tell people,
dying.
what does this really mean? It's the same as if I put you in a deep freeze, took a chainsaw, cut you here, took a big pineapple core, took a big chunk out of you. That's what we're exploring right now.
I like the virtual autopsy word better. That was a bit graphic. Yeah. All right.
So lungs look fine. No tumors, cancers, masses, pneumonias, emphysema, etc. We're going to look here at the aorta. So John Ritter, the actor, died of an aortic aneurysm. Typically, the first symptom of an aortic aneurysm or enlargement of the aorta is when it bursts and kills you. That's the first symptom. So here, incidentally, we can also look at that. So significant reassurance and peace of mind.
This round thing that we're seeing right here
thing.
and here, this is it. So let's go to the side
So
picture
on the side
here.
view, you can see it coming up out of the heart here. This is the heart.
This is it right here?
Starting right here, heading up. It's going to loop up and then come down and head back by the spine down to the belly.
Oh, that's so neat.
So that's the aorta. In fact, we can actually enlarge that view here. And that's what we're looking at here. So now I'm slicing you left to right.
Go back. Right there it is, coming down the back. And then right here it is going up. So there's the C,
there it is.
if you will.
In fact, while we're here, we can also look at the this is your esophagus right here, so we can look at that, make sure that's okay. Make sure
the esophagus, for those who might not know that term,
is the food pipe, right?
Food pipe, yeah.
That's where food comes down.
And it comes from the mouth, goes down, and it goes through the diaphragm, right? This is the liver, and that's the heart, right?
Yep.
So there's the diaphragm, and it's going to go through that. And a hiatal hernia is when part of the stomach pooches up above the diaphragm.
And that can cause bloating, gas, reflux, lots of things. And what's interesting is the same nerves that go to the stomach and the esophagus, the food pipe, also go to the heart. Yep. So many people can have reflux and heartburn, and it can feel just like a heart attack.
Yep.
That won't kill you. But there are people that have heart disease or angina or chest pain that's actually due to the heart, and they think it's reflux, and that can kill you if you think it's heartburn.
Can you turn those little windows back on here?
Yep.
So what we're looking at right here is the line between the abdomen and the chest, right? So this is the line, and then the if you go back to the little picture over here again just a second ago, is we're seeing the tube come down here. That is the pipe right where it goes through. So as what you just said to me is that if this hurts or if this hurts, because that's the heart right there, isn't it? So it's laying against each other.
You can't tell.
So when people think they have indigestion, they could have heart pain, and when they have heart pain, they think they could have indigestion. You can't tell.
The indigestion won't kill you, but heart pain thought to be indigestion can be lethal.
I've never seen a picture in my entire life that shows me how close those are together the way this does. That's really special.
So we look at the aorta, so no aortic aneurysm, et cetera. We look at the esophagus. We also look at, we're going to look at the pulmonary arteries. So the pulmonary arteries coming out of the right side of the heart, these are the arteries that send all the blood to the lungs. This is important because people can get blood clots or pulmonary embolism that can occur in the lungs. That, again, is a very worrisome kind of issue. And as I tell people, frankly, what we're doing here is many times we're doing this for people who have chest pain. And our concern is this lethal, life-threatening chest pain or not? And as I tell people, in the big picture, there's only two kinds of chest pain. The stuff that kills you and everything else. And the stuff that kills you is basically three things. Aortic aneurysm, this enlargement here, which this patient doesn't have.
This is a great view, by the way, right here. You can see the aorta there.
Yep.
The red line, we're seeing it right here.
Yep.
Got it. Cool.
Coronary artery disease, which we're going to look at in a moment, and then pulmonary embolism. If you don't have one of those three causes of chest pain, whatever that chest pain is, won't kill you.
Fascinating.
And that's a very important distinction.
For the sake of understanding, you've gone from the aorta to the pulmonary arteries. The blood comes in the superior vena cava and the inferior vena cava and flows into the right side of the heart. Then it goes from the right side of the heart to the lungs, and that's the pulmonary arteries. So there you go. Oh, that's a beautiful view right there where you can see it tree out. Okay. And then it goes back from the lungs into the heart, and then...
Here's the oxygenated blood shown in the brighter color flowing back from the lungs.
And then it goes through the heart.
Through some of these valves into the main pumping chamber. This is the left ventricle, the main pumping chamber of the heart. And from here, it's going to pass out this valve, out of the aorta, out to the rest of the body.
So then it goes out to the aorta. So you can see the whole flow of blood as it comes to
the whole
back
thing.
to that. That's so neat.
And then lastly, we always like to look at this. We're going to take a peek at the spine, and this is someone that has a lot of arthritis here in the spine. You can see all this stuff right here is all arthritis along that part of the spine.
That makes me want to sit up straight.